Okay, welcome back class to Nurs 345. Today in this session we are talking about the research process or the process of doing research. Research as a process means that there are some steps that you go through, and so we will talk about those steps. And so at the end of the class, I'm expecting each of you to be able to describe this process and then explain the phases and steps involved in the process. So we'll be talking about the overview of research process and then the phases and steps involved in the research process. Again, for this session, you can find, you can do your further reading from the Foundation of Nursing Research, which is the 5th edition and is also on Sakai. So let's look at the overview of the research process, the overview of the research process. Now this picture tells you that, you can see a circle which explains that research is done in the form of a circle. It's in the form of a circle because you make some kind of cyclical decisions. So you can move from step 1 to step 2 and realize, no, I should have made this decision in step 1. So you go back and do that and come back. That's why it's cyclical. The process is a step-by-step way of making decisions, and we will go through all that. So basically there are 5 main phases of this process. However, in some books you may find about 7 steps because they divide some of the steps into 2. Now, first of all, what you need to do is to select and define the problem, identify the research area, and this includes the literature review. The next step is to select the research design followed by the methods. Then you do your data analysis, and finally you interpret the findings. We will go through each of these. So let's look at how we select and define the research area. There are so many areas of nursing research. Health promotion is an area. Nursing education is an area. Human care, infertility, depression, they are all areas. Within this area is where you get your research topic. Now, when trying to decide whether a topic is appropriate or not, certain factors must be considered. And these are the ethical issues involved. For you to do scientific research or scientific investigation, you have to make sure that the ethical issues involved do not cause any harm to your participants. We also need to talk about the significance of the problem to nursing, the problem that you are investigating, how important is it to nursing. Then the personal motivation of the researcher, qualification of the researcher, and finally the feasibility. We will talk about each of them. Now, ethical issues. I will not waste much time on this particular slide because we have just, in the previous session, we talked about the ethical considerations in research. So it's all about making sure that your participants, you do not cause any harm to them. They have their privacy, and then anonymity is ensured, confidentiality is also ensured. Now, let's see or talk about the significance of the problem that you have identified and you want to research into. Every research or every nursing study must be significant to nursing. Why? Because we said we want to build a body of knowledge for nursing. So if you are doing a nursing research, you need to ask yourself these questions. Will clients or the nursing profession benefit from the findings of your study? Would the body of knowledge or of nursing knowledge increase by virtue of your findings? Can the results be used by nurses to solve problems? If you answer no to any of these questions, maybe you are not doing nursing research, so you have to rethink. We are saying that personal motivation in research is very important. So if you have a topic and you don't find yourself excited about the topic like the guy in the picture, then there's something wrong. Because if you don't have the passion for the area you have identified, that means you are not curious to look for solutions for the problem that you want to solve. So personal motivation is very important in research. Researcher qualification. Yes, I know we teach research at the basic nursing schools, at the NTC, but when we are talking about building knowledge for the profession, it is globally agreed that it is at the first degree level that we build the skills to be able to do this kind of research. And I believe that is the reason why everybody is in this class. And so once you have a first degree, it is believed that at least you have the basics of nursing research and can do something to increase the body of knowledge of nursing. Assessing the feasibility of the study. How do we assess the feasibility of the study? This is important because we are doing scientific research. So the researcher needs to be sure that the study can be carried out successfully. You don't want to start, get to the middle, and you cannot continue for some reasons. It's important. Then feasibility is also assessed through the following. The factors involved are time. You ask yourself, do you have enough time to do this research, or do you have enough time to find solutions to the problem you have identified? Cost. Every research involves money. Do you have the money? Equipment, administrative support, peer support, and the rest. We will talk about each of them in subsequent slides. So let's talk about time. Do you have the time? Can you spend, 5 years or 2 years doing this research? How big is the problem? How much time do you need to find solutions to this problem? So if you have, for instance, in the academic field which you are in, and all of you will be doing project works, you don't have enough time. So if you have a problem that requires that you use 1 year to do the research, that may not be feasible. And that is why we talk about time. So you think about the time as you are selecting your research topic. Money is important. The problem that you have identified, how much money do you need to do this research? Do you have to go out there to get the money, or you have to pull the money out of your pocket? It's an important thing to think about. Equipment. You may need certain equipment like computers, laptops, printers, and the rest. Do you have them? How are you going to get them? Of course, as an undergraduate student, you need to have a laptop as one of the basics for your research projects. Do you have them, and how are you going to acquire them? Administrative support. We talked about institutional review boards in the previous slides. So if you go to a hospital to do research, they will ask you where you are coming from. Do you have the support of your institution? Do you have the support of a body somewhere to do this research? If you do, that may give you an upper hand, or that increases the feasibility of the study. Peer support. One person cannot do research. One person cannot do research, and that is why in nursing we insist that you are paired up to do your project work, so you can interact with each other, discuss issues before you go to your supervisor for clarification of issues. So peer support is especially very important for novice researchers like you. So if I give you a topic and I just tell you to go and do research, you may have a problem because you need someone to discuss issues with, because we talked about the fact that it's a back and forth way of making decisions. Subject availability. The area you have chosen, would you be able to get participants in this study? So for instance, if you are studying an area like HIV, we know that HIV is a stigmatizing issue. Would people agree to participate? Will it be difficult for you to get them to participate? That is an important area. So if it will be difficult for you to get participants for the study, then it means that you cannot get the data to come up with the findings that you need. Where do nursing research problems come from? Where do we get the research problems? Now, there are so many, and we talked about this, I think, in the first slide, the first session. There are so many areas of problems, but for nurses, the topics or the areas for your research usually come from your personal experience, that is clinical experience, your experience with patients, your experience of providing care and all of that. Maybe there's something you are not happy about, or maybe there's something you are curious about. That can turn into a research topic for you. Literature sources. Probably you are reading about something and then you come up with a question that you are curious to have answers to. That can also be, you can also get your topic through that source. Existing theories can also give you a source, because if you read about these theories, you may realize that there are certain things that are discussed in the theory that are somehow vague to you. You want to find out what is happening in that area, so that can give you a topic. Then previous research. I know for nursing students, when we ask that you bring your topics, you find all of them in the library going through previous project works to be able to come. It doesn't mean you have to copy. It just means that you are reading about what has been done before, so that you can see what you want to do to make sure that you don't come up with redundant findings. Now, the steps involved in this process that we are talking about. So each of the 5 phases that we talked about also have steps, and we will talk about them. So let's look at the steps involved in the first one. Steps involved in the first one, which means that you have identified the problem, or you have the research question, or a question that you are curious about. The first or the next thing that you need to do is to read about it. So you go to the literature, read about the problem, identify your pertinent variables. Variables are the related areas that you want to measure, or the things that you want to measure. So you have to identify all of that in the literature. Then you formulate your research questions and hypotheses if it's a quantitative problem, so that you can test and come up with your findings. Now, steps involved in phase 2. The researcher designs the study and plans the method of selection, testing, and measurement. Now, if you have the topic already, will tell you whether you are going quantitative or qualitative. The topic will tell you which particular group of people or subjects that will participate in your research. So the choice of the design is not done by the researcher, but the choice is directed by the problem that you have identified. Then you have to identify the sample and where you want to do the research. You also have to define all measurements. Now, in research, when we say measurements, we are referring to the questionnaire, and some of the synonyms here are skills, instruments, and tools. They all mean the same thing, or they are all referring to questionnaire, interviews, observation, or a combination of all. Phase 3, which is the methods, an important phase. Now you have planned the research, you know your design, you know the people who will participate. Step 3 or phase 3 is where you try to implement all of that. Now you go to the field and then try to collect the data the way you have decided to collect the data, either through the interviews or questionnaire, whichever way you want to go, and then organizing your data for analysis. Now, for data analysis, if it is quantitative, then you are talking about statistics. And you need to come up with some, statistical procedures that you can use to come up with your findings. And I must mention that you need some statistical knowledge to be able to do this. However, there are steps involved because we are testing hypothesis. If we are testing hypothesis, it means that you need a statistics. And then once you test the hypothesis, you will come up with the findings. You should, if it's quantitative, they are basically numbers. The analysis gives you some numbers, some percentages. You should be able to interpret the findings that you have. Then the last phase is dissemination of your research findings. We say we want to build a body of knowledge for nursing, and so you don't do the research and lock it up somewhere because you don't want somebody to copy. That doesn't exist in research. And so once you have done that, it means that you want almost everyone, if it's possible, globally to read about the research. And so the only way you can do is by sharing the information in conferences, workshops, and then you can also do that through journal articles, publications, oral presentations, and then poster presentations. So, in conclusion, this session we have discussed the process and the phases involved in nursing research. In the next session, we will discuss the background and problem statement, and then the differences between the two. Again, here are your reading lists, which are available on Sakai. So thank you, and then I'll see you in the next session.